You know, World Obesity Day is coming up. It really is a problem affecting all of us. And so we're bringing in the experts, a pediatric orthopedic surgeon to talk about these issues from USA Health. I have Dr. Tyler McDonald here to talk more about World Obesity Day that is coming up and how this is still prevalent. I was looking on the internet and it says 60% of children have a problem with obesity, and it's a trend that's expected to get worse in the next decade.
Yeah, it's getting worse every year. Alabama is one of the worst states within the United States, but if you look at the national trends as a whole, if you look back from like the 1970s to today, our rates have tripled since then, and it's not slowing down. In fact, it seems to be speeding up.
What do you attribute to that?
It's such a multifactorial problem. It's hard to pin it down and say, this is one thing. And I think, people would laugh at me if I was confident that it was just one thing. But I think a lot of it comes down to kind of awareness and education and, parental guidance in the household about kind of healthy choices for their family and for their kids.
Now, we know that obesity can cause a number of health problems, but it also affects your bone health.
That's right.
How so?
Well, if we look at what obesity is, it's an increase in our fat or adipose tissue, as we call it. And adipose tissue actually serves a normal function in the normal body, but just like anything in life, like too much of a good thing is bad. So if you have increased adipose tissue, you have increased release of some of the hormones and proteins that it releases. Some of those things, one called leptin in particular, also some things called pro-inflammatory cytokines, can all have these effects to actually decrease your bone mineral density and decrease your bone mass.
So are you seeing children that are coming in with these types of issues?
We are. So probably one of the most common things I treat on a daily basis is broken bones. And obesity has a lot of effects in a negative way on broken bones. For one, you're at an increased risk of a more higher energy fracture because there's more mass when you hit the ground. For certain types of break patterns, obesity is a risk factor for having a more complex break pattern. Obesity is a risk factor for some break patterns for having associated nerve damage, and if you have to have surgery for it, obese children are at an increased risk of perioperative and postoperative complications. So
your best bet, right, is to prevent the problem before it starts, but how do you do that?
That's super hard. If I had that question, I'd probably be a millionaire. That's something that kind of starts with healthy choices at home. Stay away from the bad foods, and we all know what those are. Make sure we're getting plenty of good nutrients. One of the biggest things that I'm talking about in my clinic day to day, because I'm trying to get a lot of kids with broken bones to heal, is making sure we're getting enough vitamin D. If you are obese, chances are you're also probably vitamin D deficient. And low vitamin D is itself a risk factor for having issues with breaking bones more easily and low bone mineral density. So I'm always harping on patients to make sure that they're supplementing vitamin D and going to the store and actually getting a bottle of the vitamin D pills. I myself take some on a daily basis just because I like to practice what I preach.
That is good information, and we are out of time. I had a couple of questions for you, but I'll be asking them off camera. Thank you for stopping by and sharing this information with our viewers. Very important.